This is a presentation on medical evaluation boards, LIMDU and light duty, coming from the Manual of Medical Department, Chapter 18, and a little bit from Chapter 14 of the Corpsman Manual. This is not all-inclusive. This is just going to be the highlights of these sections, just highlighting mostly medical evaluation boards, LIMDU, and light duty. We can find guidance for medical evaluation boards in the Manual of the Medical Department, Chapter 18. What a medical evaluation board is a panel of providers attached to a military treatment facility whose commanding officer has been expressly designated to hold what's called convening authority, or CA, for medical evaluation boards. So not every medical treatment facility can conduct a medical evaluation board. The CO has to be designated with convening authority, CA, in order to be authorized to hold a medical evaluation board. Medical evaluation boards, they can do one of three things. A medical evaluation board can place a member on limited duty, sometimes referred to as temporary limited duty, but when you see LIMDU and TLD, those are synonymous. They mean the same thing. Limited duty and temporary limited duty mean the same thing. They can determine that a member is fit for duty. That means that they usually are clearing a member from a previous period of limited duty, and they can refer a member to the Department of the Navy Physical Evaluation Board. And it's important to understand that a PEB, a physical evaluation board, is not the same thing as a medical evaluation board. Physical evaluation boards are used when we don't think the person is going to get back onto a medically unrestricted duty status, and physical evaluation boards are actually don't even fall under MEB. They fall under the Assistant Secretary of the Navy, under the Secretary of the Navy Council for Board Reviews. So this is a different command entirely than MEB, who will adjudicate somebody's case and determine if they, are going to get disability and at what rate. So a physical evaluation board, they can determine a member's fitness for continued naval service. And those are two important distinctions we need to make. The MEB, right, the Medical Evaluation Board, that is at the level of a military treatment facility. They can put you on LIMDU, they can say you're fit for duty, they can clear you from LIMDU, or they can refer you to have a physical evaluation board, right? So medical evaluation board, fit for full duty. That's what they can designate you as, or put you on LIMDU. Physical evaluation board, they can do fitness for continued naval service, okay? And that can be different sometimes than fit for full duty, all right? So physical evaluation board, physical or fitness for continued naval service. So in our readings, we're going to come across the abbreviation MEB. I think we've already figured that out, the Medical Evaluation Board, and we're also going to see MEBR. Okay, and we're going to talk about what that abbreviation is. So your Medical Evaluation Board, like we discussed on the previous slide, is a panel of providers, and those providers are going to produce your MEBR, and what your MEBR is your Medical Evaluation Board reports. Okay, this is the document that they are going to provide as a result of convening that medical evaluation board. So it's important that we distinguish between light duty and limited duty. Light duty is what you get when you just go see your primary care provider in the clinic, the battalion aid station, and they just give you a couple weeks off for your shin splints or your knee pain or whatever the case may be. So light duty is going to be utilized when we expect that the patient is going to return to a medically unrestricted duty status at the end of that period of light duty. Light duty should not be given in periods of greater than 30 days at a time. We can give a maximum of 90 consecutive days, but we can only do it in 30-day increments, okay? 90 consecutive days total, but it has to be done in 30-day increments. And the idea is that you come in and you follow up and you get reevaluated and we put you on additional light duty. At the end of the light duty, the member will either be full duty or we're going to have to refer them for a medical evaluation board. In no case should a member reach that 90th day of light duty without a medical treatment facility submitting that medical evaluation board report that places that active duty service member on a LIMDU status. You should not reach that 90th day. So when they're coming into the clinic and you're at 60 plus days and it's not looking like you're going to get back on full duty, that's when we got to start submitting you to that MTF so you can get that medical evaluation board done and they can do the medical evaluation board report that would place you on a limited duty status. And then light duty, all light duty should be documented on the NAVMED 6310/1. All right, documented on our NAVMED 6310/1. That is what we document our light duty on, and it should be maintained in the health record. That way we can keep track and we can make sure that you don't go over that 90 consecutive days. An important thing to remember about light duty too is that light duty is a recommendation. The commanding officer of the parent command of the patient doesn't necessarily have to honor that. Most of the time they do, but they don't necessarily have to honor that. But at the end of the day, they're still responsible for the general well-being of that patient. So if the patient's on a light duty status and they do something, you know, that the command doesn't honor it and they hurt themselves even more, well, then that command's going to be on the hook for that. So now let's talk about LIMDU. LIMDU is also referred to as temporary limited duty. Those two terms, like we mentioned before, are synonymous. They mean the same thing. They can be used interchangeably. It is used on a patient who we anticipate will return to full duty. It is also used when a patient's case is being straight to a physical evaluation board. We suspect that this is a condition that they will, likely be medically separated for and that they'll incur some disability. We're going to go ahead and concurrently put them on LIMDU. Okay, so we use it on somebody we expect is going to be on full duty, or we put them concurrently on it. We suspect that they're going to, be separated because of this. We're going to submit them straight to a physical evaluation board. But it's important, going back to the point with full duty, we don't use LIMDU when we know that this patient probably won't be returning to full duty. As we're going to talk about the increments of LIMDU, we're not going to ride this out. We're not going to put them on LIMDU. They don't have to do a year of LIMDU before they go up for their physical evaluation board. If we know that they have a condition that they're likely not going to fully recover from, we can go straight into that physical evaluation board. All right, so we use LIMDU right when we anticipate a return to full duty, or we use it concurrently when we're submitting them to that for that physical evaluation board, because if they have something that warrants a physical evaluation board, we don't need them to be operating at full duty. All right, so when a medical evaluation board recommends LIMDU, when the board convenes and they recommend LIMDU for that patient, the convening authority has 5 working days to sign what's called the NAVMED 6100/5. We'll talk about the 6100/5 in a minute here, okay? LIMDU is given in a maximum of 6-month increments. We don't have to put patients on 6 months of LIMDU at a time. That's the maximum we can give without convening another medical evaluation board and granting another period of LIMDU. And we'll get into the maximum periods of LIMDU somebody can be on in just a bit here. So 2 forms we need to know when it comes to LIMDU. We've got the NAVMED 6100/5 and the NAVMED 6100/6. And if you watch the SSIC codes video, we know, right? And although this is forms, it's still applicable, right? It's still applicable. 6,000, that pertains to medicine. The secondary number, the 1, physical fitness. Well, these are forms that have to do with the LIMDU status, right? Forms that have to do with somebody not being physically fit for duty. Okay, so your 6100/5, that's what's called the abbreviated medical evaluation board report, and this is the form that the medical evaluation board is going to document somebody's LIMDU status on. This is the one when they come back to your battalion aid station or back to your clinic, you're going to use to confirm their LIMDU status and make sure it makes its way into their health record. And then if they return, right, and they get deemed, they have to be taken off of a LIMDU status by the medical evaluation board. When they do, they're going to utilize the form 6100/6, the return of a patient to medically unrestricted duty from LIMDU. Okay, 6100, remember, 6 medicine, the secondary number, the 1, right, 6100, physical fitness. So let's compare light duty to LIMDU real quick. So remember, light duty requires concurrence with the member's parent command. That is a recommendation from the medical department, but it doesn't necessarily need to be honored by the parent command. But the commanding officer bears overall and final responsibility of the well-being of their service members. So most of the time they're going to honor that. They're going to go with the doc's recommendation. LIMDU lasts much longer than light duty, because remember, our light duty, we can only do 90 consecutive days max. At that 90th day, you need to go to a medical evaluation board and get placed on LIMDU or determine that you're fit for full duty, and we can only give it in 30-day increments. LIMDU, on the other hand, we can give it in 6-month increments. You don't have to be on it for 6 months, but it can be given in 6-month increments. It requires notification to the parent command and to the servicing pay and personnel support detachment. So we need to notify PSD, because they are going to change your status. All right, so PSD's got to be made aware of your LIMDU status, and it may necessitate a transfer. If you're in a deployable unit, a lot of times they're going to have to transfer you because you're not going to be deployable, and you're going to be taking up a billet, so it may affect your assignment. And they do not require the consent of the parent command. The medical treatment facility commanding officer has convening authority. He can put you on LIMDU. They don't need permission from the parent command. It's not a recommendation. That is an official status. So when somebody's put on LIMDU, first off, we need to determine, is this a condition that warrants a physical evaluation board? If it warrants a physical evaluation board, you got to remember that is a command outside of Navy medicine that determines that determines your disability. So if it is the case, then we're going to go ahead and use our abbreviated medical evaluation board report to place the member on limited duty for a 6-month period while their case is submitted to that physical evaluation board. If it is not something that warrants immediate referral to a physical evaluation board, well, we got to determine, has the patient had a previous period of LIMDU? If they have not, then the med board at the MTF level can go ahead and put you on LIMDU. So they'll use the abbreviated medical evaluation board report and put you on 6 months of LIMDU. If you had a previous LIMDU, well, was it only one prior LIMDU? If that's the case, if you only had one prior LIMDU, then the medical evaluation board right at the MTF level can go ahead and put you on an additional 6 months of limited duty. So they'll use the abbreviated medical evaluation board report and put you on another 6 months of limb duty. If it is not the case that this will now be your third period of LIMDU, well, they got to determine, is this related to your previous LIMDU? Is this an injury that is related to your previous injury? If not, if this is a new injury and it's not the same, like say for instance before you were on LIMDU for an ACL tear in your knee and now you just had your rotator cuff repaired, well, they can go ahead and place you on that third LIMDU using the abbreviated medical evaluation board report. But they also need to let PERS, right, Navy Personnel Command, know for our active duty sailors, and then they got to let Headquarters Marine Corps MMSR Tag 4 know for, active duty Marine Corps. And what they're going to do is they're either going to make a decision if they're going to grant you that LIMDU, they're going to direct that MTF, so they'll either just give you the period of LIMDU, they can tell the MTF, no, go ahead and send that up for a physical evaluation board, or if they don't think it's medically related, they can direct the command to convene an admin board and see if an administrative separation is more appropriate. If it is related, if this is your third LIMDU for the same condition, well, a medical evaluation board report requesting additional LIMDU can be submitted. They need to specify the time, okay? So a med board can ask for a third one, but they're only going to do this if they think you can recover from this. If they don't think you can recover from this, they're going to submit you for the physical evaluation board. You're going to get evaluated for disability, and you're going to get medically separated. But if they think that there's a good prognosis, they can ask for that third period of LIMDU. They need to specify the time. And then they can submit it They can submit it to PERS, our headquarters Marine Corps, and they can make the decision whether or not they want to grant that additional period of LIMDU, or if they want you to send it up to the Physical Evaluation Board, or if we need to do an admin board. So a quick review of what we've gone over so far. What organization can make recommendations on fitness for naval service? Fitness for naval service. Well, that was your Physical Evaluation Board, right? Your PEB makes a recommendation for fitness for naval service. What form would a provider utilize to give a patient light duty? To give a patient light duty, what form would a provider utilize? They would use the NAVMED 6310/1. 6310/1. What is the maximum consecutive light duty an active duty service member can receive before being referred to a medical evaluation board? Maximum consecutive light duty. 90 days. 90 days, but it's got to be done in 30-day increments. Only medical treatment facilities whose commanding officers have blank can conduct a medical evaluation board. Only medical treatment facilities whose commanding officers have blank can conduct a medical evaluation board. Well, that commanding officer must have convening authority. CA must have convening authority if his MTF is going to hold medical evaluation boards, his or hers. What form is utilized by a medical evaluation board to place an active duty service member on LIMDU? What form will that medical evaluation board use to put you on LIMDU? They're going to use the NAVMED 6100/5, the abbreviated medical evaluation board report, the 6100/5. What form is utilized to return a member to full duty after a period of being on LIMDU? What form will put you on full duty? Well, that is the NAVMED 6100/6, return of a patient to medically unrestricted duty. This concludes this presentation on medical evaluation boards, LIMDU, and light duty. Most of this information is pulled from the Manual of the Medical Department, Chapter 18, and a little bit from Chapter 14 of your Corpsman Manual. And like I said before, this is not all inclusive, but some of the key highlights that I think will help you out. So I hope, like always, I hope that helps. Keep studying.